చెప్పండి.
There's a lot of confusion and misnomer in lay people and also people who are not informed about epilepsy. What is a seizure? What is an epilepsy? And is having a seizure is having an epilepsy? Can you kindly illustrate?
Yeah, this is a very important question. Definitely, somebody having single seizure, we should not label them as having epilepsy, because by definition, epilepsy is the occurrence of two or more unprovoked seizures. Unprovoked seizures means that there is no clear-cut setting for the seizures to happen. For example, if an elderly man is there, his sugar goes down, that is called hypoglycemia, and if he gets a seizure, it is called hypoglycemic seizure. Similarly, if the sugar goes up, it's called hyperglycemic seizure. If the sodium comes down, either because of the drugs or whatever be the cause, then it is called hyponatremia associated with seizures. Similarly, somebody gets an infection in the brain like a cysticercosis or a tuberculosis and gets a seizure. Again, it's a symptomatic seizure because of something which is acute in that setting and a seizure has occurred. Similarly, in young children, they can get a seizure with fever. So that can be a febrile convulsion or it can be a fever associated seizure. So, and somebody takes alcohol, means not beyond the routine thing, that is either during binging or excessive alcohol intake. If you get a seizure, again it's alcohol related seizure. Similarly, somebody who is regularly used to drinking of alcohol in high quantities and suddenly stops and goes into alcohol withdrawal stage and gets a seizure, again it's called alcohol withdrawal seizure. So all these are not labeled as epilepsies, they are all called as seizures. So this is mainly to differentiate seizure from that of epilepsy. So in all these settings, it's very important because these people do not need a long-term medication with anti-epileptic drugs. It's possible that you treat them only during that acute setting, or they become fine at the end of 1 month or a maximum of 3 months. So we should not label them as epilepsy and continue anti-epileptic drugs for long. But however, epilepsy is unprovoked seizures, means you do not have any of these settings. Suddenly a person comes with at least 2 or more than 2 seizures, and after that you need to evaluate them with an EEG and MRI and then identify what is the cause for that. And so definitely this is important to differentiate both, because the causes are also different for epilepsy and also for seizures, because for seizures the most common conditions are acute settings.
In lot of information sheets for the patients, we usually come across the word convulsion and the seizure. Are they same, ma'am?
Yeah, convulsion is something like a layman's term where jerking off a part of the body or the entire body is known as convulsion. So if somebody is, the convulsion can be focal or even generalized. So we can use the word convulsion synonymously with the seizure, but not with epilepsy.